So next on the agenda, we have the Office of Ombuds for Corrections Infrastructure Report. Welcome back to the Minnesota House. Person, please identify yourself and proceed.
Thank you. Ombudsperson Margaret Zadra. Did that get into the mic? Okay. This out of here. Thank you so much for having me here this afternoon. I appreciate the time. As you know, the Office of the Ombuds for Corrections is separate and independent from the Department of Corrections, and our role is to investigate complaints from incarcerated people, staff, and community members, as well as investigate systemic concerns. We can facilitate resolutions, make recommendations, and publish reports, as well as provide education and information to help people navigate the system. Our statutory mission is to promote the highest attainable standards of competence, efficiency, and justice in the administration of corrections. We really focus on issues related to equity and health and safety. So our priorities in addressing both individual and systemic issues that advance equity and provide for greater accountability and greater transparency, in addressing those inequitable systems within and outside of corrections. So that segues to our report. I think all of you have a paper copy of it in your packet. But Minnesota prisons, no news, have been under-resourced for decades, are crumbling. Within our report, we identify that as a state, we must develop a strategy to dedicate resources to upgrade and maintain facilities, as well as replace facilities that are unsafe and cannot be adequately rehabilitated. You're probably familiar with the 2020 OLA report that really looked at a comprehensive view of safety in state correctional facilities. Within that, there was a chapter specifically about infrastructure. And the key recommendation in that report included the necessity for a strategy and funding to address the infrastructure and safety needs in Minnesota prisons. In particular, the report highlighted the two highest needs facilities, which are St. Cloud and Stillwater. They are both over 100 years old. And, you know, as you see here, some pictures of Stillwater, you can see a picture from 1908. That was actually before the facility was moved to its current location. The very, very first iteration of Stillwater was actually built before Minnesota was a state. When it was moved to the current location in 1914, it was built, as you can see with the picture, in 1950, but still very similar structure. If you walk into Stillwater today, which I think a lot of you were able to join tours, you can see that it looks the same. We have not updated, and those high-tiered open-face cells are what you would also see at St. Cloud. The problem with that, of course, is that those design features are outdated, and it really increases the danger for incarcerated people and staff. I think it's important to note that there's been really important investments over the years from bonding in particular to both of those facilities, and there's areas in the facilities that have absolutely been updated, and those are important investments. And we don't want to negate that work, but there's many, many needs that are unmet, and that price tag keeps going up. A 2014 study for replacing St. Cloud came with a price tag of $400 million. Due to inflation, that would now likely be as high as $1 billion. So continuing to delay addressing these needs continues to increase their cost. It's not just St. Cloud and Stillwater, of course, that have challenges. All 11 DOC state prison facilities have significant infrastructure needs. And we've heard from many staff about the ways that they're addressing this. And I give a lot of credit for the creativity and the MacGyver level skills that staff have incorporated to keep things moving. However, that's not a sustainable or effective path towards the future. In all 11 facilities, it's not just that there's things falling apart, it's that they pose real significant safety challenges. Even the newer facilities have significant concerns, including loose and falling bricks or other parts of the building that have fallen that can either cause harm or be weaponized. Staff's resources are often directed towards mitigating, for example, standing water, rather than attending to some of their primary programming or security needs. And in every facility, there's sightline concerns. We know that this causes real significant harm. That decades of under-resourcing, as the commissioner pointed out, has led to a deferred maintenance cost of $720 million. I know this is a really challenging conversation, but we want to really be elevating what is the cost benefit here? Is there a benefit to continue to investing significant state resources into failing structures that do not best serve public safety needs? We do need to continue to house people, provide programming in these facilities. So some investments have to be made, but is that investment better made there, or is it important to be evaluating the cost of investing in new facilities? You can tell I say investigating very, very often. We're also seeing with this not just degradation that is unsightly or uncomfortable. This takes a real toll on staff, incarcerated people, and also on general public safety in Minnesota. We cannot pretend that what happens within our prisons does not affect what happens in our communities. Unaddressed infrastructure needs leads to unsafe conditions for staff. Full stop. It just does. Staffing challenges, it is much, much harder to staff the facilities that are older and have poor sightlines. There's a lot of forced overtime at those facilities, which also leads to other safety challenges. And more staff are needed to monitor those facilities. It leads to significant levels increased stress for staff, which also leads to retention issues. So even when those new hires are happening, which is fantastic, it is a challenge to retain those staff. It also leads to significant issues for incarcerated person safety. There are increased violent episodes in these facilities. There's increased stress and trauma for incarcerated people, and of course, decrease in programming and opportunities for success, which we heard about a little bit for Rush City. With that comes unaddressed health needs. Across the nation, we are seeing a significant growing need of the population of incarcerated people, and we're seeing that in Minnesota as well. If you did not see the article today in NPR, I highly suggest checking it out. It talks a little bit about the aging need of population across the nation, but also here in Minnesota. People that are behind bars tend to age faster than people in community. So over 50 could be considered elderly in a lot of ways within facilities, and Minnesota has more than 1,400 people over the age of 50 that are incarcerated in our prisons. And we just do not have the physical plant structure set up to address these needs. And it's not just aging. We're seeing a higher level of chronic illness, mental health concerns, substance use disorders, and other disabilities. A long-term strategy is critical, as antiquated prison facilities are not equipped to house and provide the high level of care that is increasingly in demand. I will also highlight that healthcare is a constitutionally protected service that needs to be provided to incarcerated people. Despite significant efforts of staff and incarcerated people, again, I really want to highlight how dedicated staff are and how creative they are. This is an incredibly difficult situation, and these decades of under-resourcing has led to a public safety crisis. Our office has provided several recommendations in order to prioritize significant resources to meet the safety and security needs that preserve health and human dignity. First of which is population reduction. I think we actually, I don't know what I'm bumping here. I apologize. I'm going to go right back. I think I might be hitting the mouse. In particular, population reduction, we can invest significantly in looking at that, particularly for people that pose little public safety risk. Many of the elderly people, aging population are posing little public safety risk. I do also want to note, as a state, we do this pretty well. Neighboring Wisconsin, they have a prison population of about 22,000 with a similar sized population of the state. And we have about 8,000. So we do this, but we have some really long sentences that are significant, and that also leads to that aging population risk. The second piece is really a comprehensive infrastructure plan. So targeted funding that would provide for a comprehensive review and long-term corrections planning. We recommend that there's a consideration for a legislative task force to direct any plan or study and include all the DOC facilities and not just the 2 highest need facilities. I think one of the challenges we've heard from legislators is that it's just really hard to see the complete scope of the problem. And we understand why the DOC often brings their top priorities, but when we're looking at these couple of pictures, when we're talking about things like the crumbling ramp, this is such a small percentage of it, and to see it in totality is really, really concerning. And it is also the only way we can really look at the total need in front of us. And so we really highly recommend that anything that we're looking at, that we're including the need comprehensively. With that, we can address security, safety, and programming needs and build those into a full scope, multi-phase, long-term infrastructure plan. Every time I'm bumping ahead. For those who must remain incarcerated and for the many dedicated staff who report to work under less than desirable conditions, maintaining, upgrading, and investing in new facilities where necessary is critical to ensure the health and safety of staff and incarcerated people. And I think I was excited to get to questions, and so finally there. Is there any?
Representative Erdahl.
Thank you, Mr. Chair, and hopefully I can match your level of excitement. One of the comments early was that one of the things you deal with are the complaints of incarcerated people. What's the most common complaint?
Ombudsperson.
Chair and Representative, the most common complaint we receive is related to medical, so health services, lack of, options perhaps, or maybe the length of time to get an appointment. And under that umbrella includes mental health care and dental care.
Representative Erdahl.
Thank you, Mr. Chair. So you were saying mental health and physical health are both. Okay, thank you.
Members, any additional questions? Seeing none, thank you so very much for bringing this report forward for us to consider.